Good morning, Dr. Feuer. Kristina Bauer with the Texas Lyme Alliance. Thanks so much for joining us today. How are you?
I'm doing okay. It's nice to see you again.
Thank you. Happy spring. It's Easter weekend here for our audience. I wanted to interview Dr. Feuer today about his experience in treating Lyme disease and co-infections, on new therapies and how he's having success in treating his patients with Lyme. So, a little bit about Dr. Feuer. Since 2019, he has limited his practice to the evaluation and treatment of tick-borne illnesses. He sees patients in person and via telemedicine from all over. His practice style is collaborative. The final decision for which treatment is taken is made by the patient after a thorough review of risks, benefits, and options. He's attended 4 ILAD's annual scientific conferences, and in 2017, he also took the basic Lyme treatment course on day 1 of ILADS and passed the exam. He had preceptored with Dr. Ronald Wilson, a Texas favorite, whose tick-borne illness practice he took over upon his retirement in May of 2019. Dr. Wilson continues to mentor him, and him and his wife were both patients of Dr. Wilson. He also preceptored with Dr. Richard Horowitz for a week in February 2019 and attended his 3-day intensive course on treatment of tick-borne illness in June of 2019. His son, Tanner, is a patient of Dr. Horowitz as well. As a consequence of his own experience with Drs. Wilson and Horowitz, he tends to lean toward Dr. Horowitz's multiple systemic infectious disease approach to evaluation and treatment of tick-borne illness. However, he is experienced prescribing herbal modalities as well as both novel persister drugs, disulfiram and Dapsone. So he is a very good, successful physician in treating in integrative therapies. So we are so pleased that you decided to join us today, Dr. Feuer, and let's get to the questions.
Okay.
Awesome. So we had spoke quite a bit over the last probably year that we've gotten to know each other. We're both residing in Texas, and so we do quite a bit of collaboration for patients and offering resources to help keep them well. But I wanted to start off with asking you a little bit about your own personal journey with you and your family and struggling with tick-borne illness. Can you tell me a little bit about how you got sick with Lyme and co-infections?
Sure. I really don't know how I got sick with Lyme and co-infections. Um, my wife became ill a few years after we got married. We got married in 1997. And, being married to a physician, I was an OBGYN at the time. I went about taking her to doctors and doing tests and trying to figure out what was wrong. And having had no experience or training with tick-borne illness at that time, because I went to a top-notch medical school in Houston, Baylor College of Medicine. I didn't have 5 minutes worth of training in tick-borne illness, assuming that's because there was no Lyme in Texas. So I eventually, ran out of tests to do for the 3rd time on my wife, and she got progressively sicker, and I decided that she probably had chronic fatigue. And my administrator at my practice, his daughter had chronic fatigue syndrome and was seeing a physician in Houston. So we went to see that physician with our giant pile of tests. And she looked it over and he diagnosed her with Lyme disease. And so that began my journey with Lyme disease in the sense of being on the radar. So while I am unaware of ever having a tick bite or a rash, I do have extensive exposure to ticks. I was born and raised on Long Island, in New York, which is basically ground zero for tick-borne illness.
Right.
In addition, far back as I can remember, we went to New Hampshire every summer for about a month because my dad, who was a CPA, he had a client who owned a summer camp, which I attended for about 2 years, but we always spent a lot of time up there. And it was a summer camp. We were outside all day in heavily wooded areas, high grass, all the things you worry about for a tick-borne illness. Furthermore, I recall having symptoms that I now know were probably Lyme disease related, such as fatigue, brain fog, anxiety, as far back as my early teens. So my wife ended up being treated by Ronald Wilson. And at our first visit, about halfway through the first visit, my wife just turned to me, looked me in the eyes and said, "Randy, you need to get treated. Tested. You need to get tested." And I was like, "Why?" Because being male, I was seriously in denial at that point. So she said, "Well, you're very symptomatic." I said, "Well, what symptoms do you think I have?" She says, "You're terrible fatigue." And I was like, "Oh, I'm an OBGYN. I stay up all night." She goes, "No, it's worse than that." So I went ahead and had a panel of testing at suggestion and a CD57. CD57 was 60 low. And at IGENX, I had a positive DNA test for Borrelia burgdorferi. So kind of hard to argue with DNA. So that started my treatment journey. Dr. Wilson treated me for 3 years with rotating oral antibiotics at that time. I did not test positive, and he did not feel that I had any coinfections at the time. So it was a fairly straightforward Lyme disease diagnosis and treatment. And by sometime in 2017, I was declared in remission. Most of my symptoms were gone. I was feeling pretty well. Dr. Wilson, around that time, let me know he was planning to retire. Did I want to take over his practice? And I jumped at that opportunity to pay forward the favor he did for us. And so I'm sorry. So part of my training was I spent some time with Dr. Horowitz in February of 2019. And actually, because my son has congenital Lyme and was very difficult to treat, I spent much of that time nagging him to take my son on as a patient, although he wasn't seeing new patients at the time. So on the last day I was up there, I pushed him a little bit, and he said he would do it, that we should make him.
Excellent.
Yeah, I thought that was great.
Yeah.
And so I thanked him and told him I'd see him when I brought my son back. And he said, "No, we need to talk. I've been watching you for a week, and you're clearly relapsing for Lyme disease." And he was right. Again, a word search and brain fog and stuff like that. So he suggested that because he was training me using Dapsone for Lyme, that I should make up my own Dapsone protocol. The best way to learn how to treat was to treat myself. And so I did. I made up a kind of a longer than necessary protocol, showed it to him. He said, "Fine, do it." And was treated with Dapsone and 3 other antibiotics and supplements and things like that for several months. And then Um, he told me it would be a month or two after I finished treatment before I really felt well. But about 2 weeks after I finished treatment, I woke up one morning, I had no symptoms at all.
That's
And
great.
it stayed that way for about a little over 14 months. And so in the fall of 20, um, I started feeling bad again. Um, and it didn't seem exactly like just straightforward Lyme disease. It wasn't COVID. I tested for that. Um, and then, so I did a full panel test at IGNX in January of this year. And for the first time ever, I tested positive for Bartonella, which turns out I got from a cat. One of my daughter is a kind of a rescue mom. She's always bringing home strays. And so one of the three indoor-outdoor cats we had was particularly affectionate and used to sleep with me and scratch me a few times. And turns out that's where I got Bartonella. And so I've been treating for the third time. Um, um, my wife and son, um, both have Lyme and Bartonella.
Okay.
Um, and my son he's congenital, so he's particularly difficult to treat. Um, and so he has a lot of medication refusal and things like that. And
Right.
we're having issues. My wife pretty much stopped treatment in order to take care of him. And so that's where we are.
Very common, very common. I spoke with your wife about that, encouraged her to take care of herself as well, because obviously, as a mom with 4 congenital Lyme kids myself, it's real easy to get caught up in putting your kids first, and you can't be effective for your kids if you're feeling crummy and can't think.
Well,
Hope that
thanks for that, because she
yeah.
didn't listen to me much. So.
Well, she's super awesome. I love your wife and your family, and that's kind of what we do over here at Texas Lyme Alliance is provide resource and support. So it's a self-inflicted job, encouraging people to take care of themselves, and one that I have to listen to and remind myself of daily. So you covered a lot of ground there, and that's really great. Can you tell me with some of what treatments you are treating or have treated yourself with Lyme disease and Bartonella? And technically, it sounds like since you're a physician and you're well trained with this kind of stuff at this point, you're underneath the care of Dr. Horowitz as a patient. Is that how that works, technically speaking, with you being a physician?
Well, technically, I, I,
I wanted
I've,
to point that out.
I've had his advice on how to treat himself.
Yeah. So what have you treated yourself with under his care? Dapsone, disulfiram, rifabutin?
Yeah. So starting in 2019, he suggested I do the full Dapsone protocol as it stood at that time, uh, according to his publication in February of 2019. And what
Right.
that included was Dapsone for a period of time, starting at a low dose, 25 milligrams, and gradually titrating up uh, to 200 milligrams, which was a suggestion, even though his publication topped out at 100 milligrams. He felt like 200 would be better. So I finished up with 200 milligrams of Dapsone for an 8-week period of time. In addition, he uses 3 other antibiotics, not always the same 3, but most commonly rifampin, doxycycline, and plaquenil. And that's what I did. Dapsone has some side effects. It can make you anemic because it's an anti-folate drug, and it can, at higher doses, can cause an inactivation of some of your hemoglobin. That's called methemoglobinemia. And so, we took the supplements for those side effects. Plus, it's a Herxheimer inducing drug. And so we use supplements to manage cytokines, which is what primary reactions. That included glutathione, alpha-lipoic acid, and acetyl-L-cysteine, erythritol.
Your microphone cuts out every once in a while. What was the word you said before, resveratrol?
And acetyl-L-cysteine.
Yes.
And
Is it N-acetylcysteine? Is that?
And acetyl, yes.
Yes, I say it differently, so I was not hearing it right. Yes, thank you.
I understand. Most of us call that NAT.
Yes, exactly.
Because it's easier. And in fact, that's what it says on the bottles.
Gotcha. Thanks.
And then also to decrease cytokines, use anti-inflammatories such as curcumin and low-dose naltrexone.
Good.
And
yes,
so
love that.
I took all of that. And, I tolerate it pretty well. I have pretty much an iron stomach, so I got away with taking all that high-dose antibiotics pretty well. So, and then, like I said, as I said, 2 weeks after I finished it, I had no symptoms whatsoever. Everything was back. I would wake up feeling rested. I had no joint pain. Actually, 2 weeks after I finished the protocol, I woke up and I didn't just feel good. I felt better than I had since I was 20.
Oh, wow.
I was impressed.
That's great.
I woke up feeling rested every day. My brain was sharp. I could do math in my head. Remember what fish stood for in the fish test. So it was quite good. My CD57 went up to above 150. A lot of things that speak towards it being a good remission.
Wow.
Yeah.
That's really high. That's great.
Yeah, it was good.
Yeah, that's excellent news. Okay, so that CD57 really sums it up for us. I know insurance companies say it's experimental, but boy, I've watched mine for 8.5 years fluctuate with treatment, and I think it's pretty remarkable to follow.
Well, my son, he got diagnosed when my wife got diagnosed, and we just sort of looked at each other and went, "Oh, that's what's wrong with Tanner. He has congenital Lyme." Because my wife was certainly ill during and immediately after pregnancy, and we didn't know from what. His son was 7 when my wife was diagnosed, and so it was suddenly obvious. At that time, he's 14 now, so that was 2014. We couldn't find anyone who would treat children in Texas. And in fact, we tried to get appointments with some of the more famous pediatric Lyme docs, like Dr. Corson, Dr. Jones, and they were booked for long waiting times and things like that. But so we ended up going to Washington, D.C., to meet my son at the Gemsek Specialty Clinic. And Dr. Gemsek is not a pediatrician, but he had an excellent pediatric nurse practitioner. And my son was actually pretty compliant at that time. And we got very close to remission after about 2 years. And when we had a major setback, and we uh, needed to do some repeat educational testing because we were looking for a better school for him. And he came up with a substantial decrease in IQ on the testing, which at the time nobody could seem to figure out. And the nurse practitioner checked with some Lyme literate psychologists and came up with the idea maybe we should decrease my son's psychiatric meds. So we did. And unfortunately, that resulted in quite a regression. And we just never seemed to catch up after then. He became pretty on compliant and all. And we subsequently, got a diagnosis of PANS, which explained IQ testing. And we're working on things on that kind of stuff.
Good.
So
Yeah.
we'll hope.
Yeah, absolutely. Best of luck with that. And this is, as our audience probably well knows, if they're watching this video, congenital Lyme is a real problem, and it can become a generational illness. I passed it on to all 4 of my kiddos, and Lyme disease is a cousin of syphilis, and everyone knows that that is a persistent infection and can be passed on in mother to fetus transmission as well. The CDC also hosts that now on their website, admitting that it can happen in Lyme disease. So I just wanted to mention those facts for our audience, that it does happen and something to look out for. And God bless Dr. Wilson. He did you the same justice that he did my family. And as soon as I started treating, I very quickly learned that he wanted my kiddos to be tested as well. And yes, we have 1 positive and 3 indeterminate, which is, you well know as an OB-GYN, it's like being halfway pregnant. It's not possible.
Right.
So, yeah, absolutely.
Yeah.
It's a challenge.
Yeah. So, I mean, congenital Lyme is a different disease, basically, than getting a tick bite and a rash. It's clearly been documented that you can pass Lyme disease from mother to fetus. They've recovered positive DNA tests of umbilical cord blood at delivery, and cultured not only Lyme but also Bartonella and Babesia from placental samples. So there's no question about it. But because these kids are born with elevated inflammation from these tick-borne illnesses, that they're prone to multiple other inflammatory-based diagnoses, as autism spectrum diagnosis, disorder, ADHD, PANS and PANDAS, POTS, and sometimes also EDS, which is Ehlers-Danlos syndrome.
Yeah.
And I've seen congenital kids with mast cell activation syndrome, and a couple with chronic regional pain disorder, all of which you would think is related to the inflammation picture. In moms who already carry a diagnosis of Lyme or co-infections, we usually can treat them during pregnancy with fetus-friendly antibiotics, which, I was an OB-GYN for 35 years, so I know what to prescribe on that. And both my experience and Dr. Howards' experience is that vast majority of patients who are treated that way, the babies are healthy. So, fortunately, it's been difficult to diagnose tick-borne illness, prior to every pregnancy. So, we still see congenital.
Yes, and I want to point out for the audience that IGeneX has a kit for pregnancy that people can order ahead of time, and that's recommended to get a hold of them before you go into labor so that you can get the kit shipped to you and prepare the kit and speak with your physician, your delivering physician. And do you have anything that you'd like to add as far as preparing for childbirth to avoid congenital Lyme in a mother who has been diagnosed and treated for Lyme disease during pregnancy?
Well, during pregnancy, we would prescribe antibiotics that were safe. In general, it's going to be like azithromycin and cephalosporin. And I recommend to my patients they take the antibiotics all the way through breastfeeding, although most likely cannot transmit Lyme disease by breastfeeding, since most people cannot get Lyme disease orally. But still, I think it would be prudent. So,
Yes.
like that, I usually consult the patient's obstetrician directly and explain what's going on and what we'd like them to do at delivery, and how we get that set up. And most obstetricians are very receptive to do that.
That's great. That's great. Okay. So moving on to some questions about your practice. So our interview today is to talk about your own personal journey with Lyme disease and co-infections with you and your family. So thank you for all of that great information on a personal level. But as far as patients who might be needing a physician trained in Lyme disease, especially in Texas, as you well know, they're few and far to come by. But what would you say to future patients about your practice and how you treat multisystemic infections? We've touched on some of it and how you've treated yourself, but what's that look like for future patients?
Sure. So I'm very collaborative with my patients. I strongly believe that if you're a patient for any disease, that you need to be fully on board with the plan, because it's really your responsibility to decide what goes in your body. And just so to that end, although I tend to lean towards the multiple systemic disease model of Dr. Horowitz, which generally involves antibiotic therapy along with supplemental and sometimes herbals and things like that. I'm not married to that. I've treated patients with pure herbal therapies. I've used combinations where I've used herbal therapies to substitute for one or two antibiotics because patients may not tolerate the full antibiotic protocol. And I've treated a substantial number of people with Dapsone protocol, 150 patients in the last 2 years. And I also utilized disulfiram, and I about 125.
I can't hear you.
About 100. I've treated about 125 patients with disulfiram.
Okay.
And so there's a wide selection of choices for my patients.
That's great.
In addition, I'm supportive of so-called alternative or holistic modalities, even if I don't prescribe those in my office directly. And so I've had patients that I've been happy to recommend things like hyperbaric oxygen therapy. I've had several patients do hypothermia treatments, stem cells, ozone treatments. I'm a fairly big believer in intravenous glutathione for my patients who have access for an intravenous. Also, intravenous vitamin C or Myers cocktails. I have patients who use Rife machines. I'm strong supporter for far infrared sauna treatment, which works particularly well um, for Lyme, but also for um, my patients with Morgellons syndrome. And I have treated at least a dozen patients with Morgellons. Um, and such things as dynamic neuro retraining system, as Annie Hopper's,
Yes.
which works particularly well for patients with multiple chemical sensitivities, severe anxieties, electromagnetic sensitivities, and it actually has about 15 different diagnoses that it works for. I've done this myself for the anxiety, especially um, after I contracted Bartonella, um,
Okay.
and I find it effective. Um, I saw a good lecture at the last ILADS called "It Ain't Just One Thing,"
Yeah.
um, and there is really what they call a septad of 7 different diagnoses that are extremely common in Lyme patients, and so I have to be able to treat patients for all those, or at least be able to have good referral sources. And so that's not just Lyme, Bartonella, and Babesia, but also POTS, which is a vagus nerve dysfunction that can cause severe fatigue, dizziness. People can pass out. Um, um, Ehlers-Danlos syndrome, and there's an associated condition called craniocervical junction disorder that can cause injury to your spinal cord at where your neck meets your skull, mast activation syndrome, and PANS and PANDAS. Those are all very common.
Yeah.
Um, and I have experience treating most of those. I'm not proficient at treating Ehlers-Danlos syndrome or craniocervical junction, but I have excellent referral sources for those patients.
Great.
Um, I also screen my patients for mold mycotoxins.
That was my next question. Thanks for
Yeah,
mentioning
all
that.
right.
Yeah, keep talking. You're
Heavy,
doing great.
all right, heavy metal. I have protocols for parasite treatments, um, which Dr. Horowitz was kind enough to share with me. Um, and so, I mean, there's quite a variety of things that we have to treat when we're taking care of patients with tick-borne illness.
Yeah, that's quite a lot. That's excellent. I think you just covered the rest of our entire interview right there. That's so important to talk about. So one thing that I wanted to touch on before I ask you a few other questions, what does detoxing look like for you? I don't think we really talked about that before the interview and preparing our questions, but you did mention some of these things as far as infrared sauna, things like
Right.
that. Binders, do you use binders? What's that look like when you start talking about die off and how people can maximize their healing through detoxing some of these toxins and maximizing their methylation, things like that?
Yeah, so it's important to deal with the cytokine production that you can get not just from tick-borne illness, but certainly when you're herxing, that cytokine production is what causes it. There's 2 kinds of cytokines. There's ones that cause inflammation and ones that decrease inflammation. And so the goal is to try to um, influence your immune system to make more of the anti-inflammatory cytokines and fewer of the pro-inflammatory cytokines. So you'll feel better because uh, you can herx not just from antibiotic treatment, but certainly from herbals.
Yeah.
And you even can get Herxheimer reactions from binders and mold treatment. And so it needs to be addressed, and that's what we do right off the bat. And there's um, probably dozens of different things you can use, but I have a basic protocol that starts out with liposomal glutathione, ALA, NAC, resveratrol, curcumin, and low-dose naltrexone. I also recommend either hot Epsom salt baths to draw out toxins and to decrease cytokine production. Far infrared saunas are great. Not everybody can afford a far infrared sauna in your home, although you can get like a zip up version of one from Amazon for about $200. But also multiple places have far infrared saunas that you can subscribe to for a reasonable amount per month, and you can use it, 3 to 5 times a week. And those are places like these freestanding massage places like Massage Envy. Um, I don't get any from Massage Envy for recommending.
Yeah. I didn't know that, but some gyms and things like that. But I also wanted to note that I've bought several saunas off of Facebook Marketplace or eBay or things like that. And you just want to make sure if you do find a used one that you use peroxide or something clean to disinfect. It sounds pretty gross, but they've been very effective for my family. And these low EMF is really important. That I'm sure you're familiar with recommending something that's low EMF. But a lot of these places may market their saunas to be low EMF, but finding reviews from patients that have used them is really important. I'm not going to mention those that do false advertising, but I have had personal experience with that. So that's why I mention it. It is important. You don't want to be detoxing and then causing yourself more trouble down the road with other things. So, okay, so that's really great. We talked a little bit about your testing that you utilize to help patients heal along their journey. What else would you like to mention to potential future patients on the type of testing that you utilize, as far as you've mentioned some of the traditional ones like IGeneX or DNA Connections or Galaxy, but what about some of the other more holistic or integrative types of testing that we've talked about that you can mention while we're filming here?
Sure. So, while I don't produce those tests in my office, I don't train, I don't have the equipment to do that. Um, I am certainly comfortable if a patient does muscle testing. There's a variety of other modalities you can use. So Lyme tick-borne illness is predominantly a clinical diagnosis. That means a good history and sometimes physical findings, exposure risk, things like that, plus a symptom diary can frequently, unequivocally make diagnoses for Lyme and some co-infections.
Okay.
Traditional labs, in general, don't do a great job on Lyme testing.
Yeah.
Or some of the co-infections. Some of the co-infections they do okay,
Yeah.
like the Ehrlichia and Anaplasma, they do pretty well. There are false positives and false negatives,
Okay.
but they don't do very well on Lyme testing, Bartonella or Babesia. And predominantly that's because they don't test enough different species. So for instance, there's 26 species of Bartonella, and commercial labs tend to test for 1 or 2.
Right.
It's pretty easy to miss. And doing a Western blot or an immunoblot on a commercial lab suffers from the changes to that kind of testing that CDC made after the failed vaccine trial in the 90s. And
Yeah.
just quickly, that vaccine was done using antigens um, from Lyme disease bacteria that are the most common ones. And they're numbered, they call them bands 31 and 34. And so CDC recommended not using those bands going forward, which makes it harder to get a positive test because they were the most common one.
Right.
And so especially labs started popping up that do a better job on not just Lyme testing, but certainly Lyme testing where they put back the two bands and treat multiple species of Borrelia, not test multiple species of Borrelia. And so labs such as IGNX do a much better job on immunobots.
Great.
In terms of co-infection testing, Galaxy does a very good job on Bartonella testing. They have a gold standard test that's a triple draw PCR or DNA test done with 3 different blood draws on different days. And that makes it a lot more sensitive, much less likely to have false negatives. And so those are some examples. IGNX has FISH tests, which is an RNA test similar to tests that were done for COVID or done for HIV that are highly specific with very few false positives and fairly sensitive with fewer false negatives. That test is done on the genus level, meaning Bartonella, not Bartonella ensilae, for instance, which is species, and so covers all the different Bartonellas, and it covers both the species. There's some newer tests out there. Red Labs, which is actually in Belgium, has a test called the Phage Felix Borrelia test for Lyme disease.
Yeah.
They take advantage of the existence of something they call bacteriophages. Bacteriophages are basically naked DNA without the cell.
Okay.
It's the same DNA that would be Borrelia burgdorferi DNA and other species of Borrelia, including tick-borne relapsing fever Borrelias like Miyamotoi. And so what a bacteriophage is like a virus that infects bacteria. And in this case, each kind of bacteria, say Borrelia, in this case, Borrelia burgdorferi, will have a population of viruses in your bloodstream that have the same DNA as Borrelia, as Lyme disease. Mm-hmm. And for every bacteria in your there's about 10,000 bacteriophages. And so you're 10,000 times more likely to get a positive test on this particular, using bacteriophages. So it's a pretty sophisticated test.
Right.
Galaxy has a test called a Lyme nanotrap. They use a technology to isolate from your sample, urine sample, to isolate the one of the bands, a band of antigens that are specific to Lyme disease, and so it's a better test for getting a positive test for Lyme doing that. And there's a new test from a lab called T Labs, which is for which the medical director is Dr. Robert Rosieni,
Oh, yeah.
who is the president of ILADS, recent past president of ILADS, and a recognized expert in Bartonella.
Excellent.
And so this test uses something called a confocal laser microscope. It's just a very high power microscope. And they can actually see the Bartonella on a peripheral blood smear. And they can also look at
Sorry.
biofilms
Oh,
in your
biofilm.
bloodstream.
That's
They can
great.
actually see that. So there's a lot of new tests on the market, but generally you have to use a specialty lab to get
Yeah.
a good result.
Yeah, absolutely. Okay, can you touch a little bit on how you test for heavy metals?
Sure. So heavy metals tend to accumulate in your body over time. And we mostly worry about mercury and lead. And so a lot of the heavy metals will be stored in fatty tissues like organ tissues. Um, also find heavy metals in blood. If you have acute poisoning with heavy metals, you can find them in hair. The problem with doing heavy metal tests on urine tests that are provoked with chelators is that you can, if you give enough chelators, you can get a positive test for lead and mercury because there's much of it around. The state boards frown upon using chelators because they think it makes for an unreliable result with false positives. So that you can have heavy metals in your system doesn't mean you're poisoning. And so I respect that, and I won't use chelators to do testing. And so a good alternative is use hair because it gives you more of a current level of heavy metals in your body on hair testing. I use hair testing for that.
Okay.
However, treatment with heavy metals generally includes oral chelating agents, and so that's a safe way to do it. And no one has a problem.
That's great. Yeah. Yeah, very good. Okay, that sounds like a nice conservative approach, which I love as a mom. What about parasites? How do you test and treat parasites?
Yeah, so parasite testing is difficult. However, intestinal parasites are pretty common in Lyme patients. Ticks carry some of these parasites.
Right.
And so many Lyme patients would benefit from treatment. And so when it's appropriate to do treatment, we use, I have two different protocols from Dr. Feuer, which is kind enough to let me use. One is a 7-day treatment protocol. It uses 4 different drugs, and another one is a more extended treatment protocol that takes about 2 months. For most patients, the 7-day protocol works pretty well. Sometimes I generally will, if the patient desires it or recommend it, early in treatment, and then usually makes sense to repeat that towards the end.
That's really smart. I like hearing that you do that because I have found through treating, I guess now 8.5 years, there's 5 of us in my house with this stuff, that parasites tend to hold some of these pathogens. And as we are treating, it seems as though when you go to treat parasites, you get a rebound of more infections because it seems as though they're harboring some of these pathogens. Do you find that with your patients that it can cause them to not heal all the way, and then if you do parasite treatment, they're bursting open to
Well,
reinfect them with some of these illnesses that they previously had seen close to remission or remission with.
well, I don't think that failing to treat parasites would prevent someone from getting urine, but certainly I think it may play a role in relapse. And so I think it does make sense um, to treat um, parasites during treatment as opposed to, say, after treatment.
Yeah. Yeah. Okay. Well, I just wanted to see if I was on track with that. It's typically what I see in our support groups and what I've read, but wanted to hear what you had to say about that. So mold, what's your treatment look like for mold? I have seen and interviewed so many doctors, including Dr. Cowden and so forth. They all say it's a really big deal for Lyme patients who are immunosuppressed by this Borrelia, and you can't run from mold. We've remediated in my house 7 times.
Oh my goodness.
My body cannot tolerate mold at all. So what do you think? And to be honest, it's pretty common in the support groups that people have a residual home infection, if you will, or recurrence of mold.
Mhm.
What do you do for people, maybe like my family, who has continual recurrence of mold? A lot of other people might live in more humid climates where it might be more common. Us in Texas, we tend to have a fair amount of humidity. It's not as dry as a lot of people think. What do you think about?
Yeah, well, certainly not down here in Houston, it's not. Um, so um, I, I test and treat for mold on most patients, especially patients who have had water damage in their homes. Um, uh, I use testing, urine testing with usually glutathione provocation because mold mycotoxins are fat soluble, and you have to get them, and the tests are done on urine, so you have to make them water soluble, and glutathione's your major antioxidant. That's what it does. And so, um, especially patients who have had water damage in their homes, I test. When we find mycotoxins, even one mycotoxin is too much, and it definitely causes inflammation in your system. If the patient is sensitized to mold, has antibodies against mold, um, then they will get sicker
Mhm.
when they have mold mycotoxins in their system. I use a treatment protocol from Dr. Neil Nathan, which is more or less based on Dr. Shoemaker. And so we treat
Doctor Who, I'm sorry.
Dr. Shoemaker, Richard Shoemaker.
Okay, that's what I was wondering.
Okay.
Yeah. Yeah.
And so that involves treating um, both the sinuses and the gut.
That's
Those are the
right.
2 places where mold spores will set up shop. Mold spores absolutely make uh, biofilms. And so we use biofilm busters, predominantly EDTA, as a nasal spray, or
Yep.
it's also found in a supplement called Interface Plus. That is for the gut. It's an oral supplement. And we use antifungal treatment. We can use amphotericin B. That's what Dr. Nathan recommends a lot.
Which one was that? I'm sorry.
Amphotericin B.
Okay.
The advantage of amphotericin B is that it's not absorbed from your sinuses or your gut.
Okay.
And so very few side effects in that respect. Disadvantage is it's pretty expensive. There is a product called BEG spray,
Yeah.
Bastracin, EDTA, and gentamicin that is a good antifungal and already has the biofilm buster in it. And so that works. You can just use one spray for both, for sinuses. And then for the gut, we would use the Interface Plus and an antifungal. In addition, we use binders to bind the mycotoxins.
Okay.
And the way a binder works is it will take the toxins out of your bile, and it will hold on to the toxin when the bile gets reabsorbed back to your liver, and then the toxin will be excreted in the stool. And of course, the sinus from the spray in your urine.
That sounds really
Effective.
good.
It's effective. It takes a long time. We can follow the treatment with repeat mycotoxin tests.
Okay.
Once you, a lot of times I'll do this testing early with a new patient and who's not on treatment and is not doing detox. And later, when we would do a repeat test, the toxin levels will go up dramatically. And that's not because they're not getting better, but it's because they're doing a much better job of detoxing and they're getting rid of the toxins.
Yeah.
So I've found that it doesn't make sense to retest early, and it's relatively expensive test. So I usually don't retest for about 9 months. And most patients are clear in 9 to 12 months.
I wondered that.
However, if you continue to live in a moldy environment, it's not going to get better. And so, testing and remediating is advisable. What works better is, if you can, is to move into new construction. And so I have a patient who rents, and she's been through 4 apartments in the last 3 years trying to get away from the mold. So my patients don't get better, it's almost always because they're still being exposed to mold. Patients who are sensitized to mold, who get sick acutely, not just from the inflammation, but because they have antibodies against it. I've had some luck referring those patients for low-dose immunotherapy against mold. Have good providers.
Yeah, that's great. We've had good luck using LDI, low-dose immunotherapy. Is Great Plains Labs a test that you typically prefer for mycotoxins, ochratoxin, that kind of stuff?
Yes. So there's 2 different choices: Real-Time Labs and Great Plains.
Okay.
Great Plains has 2 advantages. It tests for more mycotoxins, and it's about half the price.
We like that as Lyme patients. We need to pay attention where we can.
Patients frequently request the Great Plains kit.
Yeah, I wanted to make sure to mention that. And then do you use cholestyramine to help bind mold? Or a lot of people find that that's difficult for the stomach to tolerate.
Yeah, there's several choices for binders.
Okay.
Cholestyramine works very well for a specific mycotoxin called ochratoxin A. You can get compounded cholestyramine that doesn't have the stuff, the fillers and all that some people react to. But binders can be harsh. They can cause you to herx. So you could use activated charcoal and bentonite clay.
Yeah.
It binds all mycotoxins, but clay is pretty harsh. And so there is a binder that Dr. Nathan recommends called OptiFiber Lean that is very gentle and also binds all mycotoxins. So sometimes I use that.
That's really wonderful. I had learned about GI detox from Dr. Kinderler, and it's got the silica, aloe, bentonite clay, activated charcoal to kind
Hmm.
of help rotate maybe some of these different binders for that reason. Have you heard of that one?
Yes, and useful because it'll cover everything, right? So,
Okay. I wanted to hear about what your thoughts were on that. We didn't dive into it a whole lot in one of my interviews with Dr. Kindler, but I've been using it myself and it tends to really help. I feel better. So that's typical for a Lyme patient to stick with that stuff that's helping them feel better. I wanted to go back to one thing that you said earlier that I wrote down that I think is really important. A lot of Lyme patients don't find a physician who has enough respect for the intelligence level of a Lyme patient and listening to their own body. And I find that I really wanted to compliment you on the word that you used when you explained the relationship that you establish with your patients is a collaborative one. That
mm,
tells me as an interviewer and a Lyme patient that you have respect for Lyme patients. And I wanted to point that out for other Lyme patients before we move on, that that's a good doctor, people, somebody who's going to listen and not just preach and get you in and out the door and to the payment counter. So be choosy. And this is a great doctor here. And I'm so proud that I can refer to you patients here in Texas. And I will continue to do so. That's really important that you are respecting patients enough to listen. So thank you for that.
well, thank you for the kind words. Actually, I found that Lyme patients are the most well-educated patients that I've ever worked with.
Thank you. Yeah, we do a lot of reading because we're so desperate to get better. And I can't show you guys, but I have books all over this room that have been sent to me as
Mhm.
gifts from physicians that I've interviewed and that I bought on my own. And boy, they've been life saving. So that's why is we don't have information readily available to us from the medical community, so we have to go out and get it. And
Right.
boy, when you pay for it like that, you really tend to hold on to it and dive deep into each and every word and syllable. So the next thing here is what success stories can you share of your patient's healing?
Well, I have a young lady who she's an adult, but maybe 20 years old, had very severe neurological Lyme. She was having frequent seizures, and by frequent, I mean like every 5 minutes.
Oh my gosh.
She was having involuntary muscle jerking. It was really profound. Um, and so she basically was post-ictal from her seizures most of the time. And she had diagnosed her with Lyme and Bartonella. And she did really well with treatment for Bartonella. We got that in remission. And then she did a Dapsone protocol and got a full remission and was completely well to the point where at her last visit, her sister declared it a miracle, that she was back to the sister she used to have. Um, so I have patients. Dapsone works spectacularly well for a lot of people. Um, uh, that's like I got girlfriend patients who do very well also for the basically progressively disappear. So, uh, but that young lady was my most impressive uh, course of treatment.
Wow. So it sounds like you said earlier, if I heard you right, you have about 150 patients that you've treated with Dapsone and 125 of disulfiram. Is that right?
That's right.
Yeah. So it's
About
almost
it.
even. That's almost even.
Yeah, there's a lot of demand for disulfiram from patients, and so you know I've learned how to use it safely,
Yeah.
and so why not? It
Yeah.
works.
As long as people are healing on it, we'll keep using it in the Lyme community. But if there's something better that comes along, I'm not married to anything. We're willing to rock and roll with whatever research comes up
Yeah.
with that's better. That's wonderful. So I'm happy that we have a couple of great drugs out there that are doing wonderful things, and a couple of great researchers that have done excellent work, Dr. Rajadas and Ravi Potnini on disulfiram, and
Mhm.
Dr. Horowitz has done a great job as a practitioner in getting the information out on Dapsone. So a big hats off and thank you to those um, people who have made these things possible by the generous donations of Bay Area Lyme Foundation for the disulfiram work, and they're furthering to extend research in different areas as well.
Mhm.
So I'm super happy that finally we've moved away from relying on the government support. And I think in the last 30 years, there's been one research study on treatment by the government. So we're going to solve this. I'm 100% certain and confident that we're going to solve this, but it is going to come from people like you and I, and nonprofits, private support. So that's
Mhm.
fine by me,
Yeah.
as long as we get.
Another reason for optimism recently is the Cone Foundation has funded a
Yes,
research and treatment um, uh,
center.
foundation center, thank you, at
Yeah,
Columbia University in New York. And
Columbia.
yes, and that's fantastic.
$16 million, and they're going to start treating patients this summer.
Yeah,
That's
well, Steve Cohn's done,
phenomenal.
yeah, Stephen Cohn's done an amazing job. He really stepped up.
And
And
amazing. Yeah, they gave 25 million before that, and then so they have given a total of $100 million. And I just spoke with Bay Area Lyme co-founder Bonnie Crater yesterday, in how we can, as Texas Lyme Alliance, start to promote fundraising efforts toward solving the lack of treatments on the market. And she identified that this is going to take $1 billion. So this is going to take more
yeah,
money than what the Cohens have. And there's been 2 million to MIT. We had advocated legislatively last year with the Center for Lyme Action. We now have a Lyme lobbyist formally that works full-time on Capitol Hill for the Center for Lyme Action, co-founder Jeff Crater. So lots of really great things to be hopeful for. We increased the government funding for Lyme disease last year for 2021 this year by 65%. So I
mhm,
really hope that Lyme patients hear all of these numbers. They're ginormous. And I remember being disabled in bed weeks at a time. And all I kept thinking was, this is the most horrific thing I could ever imagine in any nightmare. Who is speaking for us? And that's why I do these interviews with people like you, because I'm speaking for those who can't get out of bed, and you are. So I think it's so important that people hear these numbers and they watch these videos. I'm not the only one doing this kind of thing. There's Health Guy, Better Health Guy, Scott's doing them. There's lots of other people that are coming up and speaking on behalf of Lyme patients. So I think that's really great to focus on that. Thanks for indulging. Okay, so what would you like future patients to write down to prepare for their appointments? I know that's such a big task when you finally get into a good Lyme doctor and you're just stunned by all of the things that you've had circling in your life that's been, affecting your poor health. So I always recommend for people to make a list, and I tell my kids the same thing, and then we'll be prepared when we get to the doctor's office. What would you suggest for them to write down?
so I think it's important for them to write down their Lyme story, um, similar to what I described with my story.
Mhm.
Hopefully not. not
Yeah, that was
involving
great.
children and stuff. But definitely, need to know where they grew up, what other medical problems they have, they've had any testing or treatment in the past for an illness, what about tick exposure, things like that. It's good to write it down because I'm a Lyme patient. I have to write it down or I'll forget. But it's also they should know that when they come to see me, we're going to spend as much time as they need or want. There's not a specific time limit. And if I run over, I run over. I think it's important for them to be heard, until they feel like they've been heard.
That's fantastic. Thank you so much for saying that. And you're sounding more of a miracle doctor. The more we keep talking, that's so hard to come by. When you go into a regular physician, it's 15 minutes, boom. I used to get a phone call or an email in the portal from a physician whom I don't use very often, but I still stay in touch with from time to time. But she would remind me, you're here for one thing, that's it. Well, I thought, if I ever get a cold or foot fungus, I'll be sure to keep that in mind. But the lack of time, 15 minutes, you can't touch on a darn thing in 15 minutes. I can barely get out, hi, how are you? Good to see you. And, and reciprocate that within 15 minutes. So that's why I always like to ask that question, because the time that a physician allows a patient to be heard is really amazing. Although I can't imagine one patient's going to come in and see you and give you their whole life story and everything that's troubled them with their health in one appointment. Of course, that's a progressive relationship that you build with a physician, but writing things down is really important, because when I'd get into an appointment, Lyme brain used to be such a, problem for me that I would just be like sitting there going, I can't remember a darn thing, but I just know that I'm so sick and I can't function, take care of my kids, drive my car safely, things like that. So thank you for doing that. That's really a compassionate sense of higher standard to set for those listening that might be physicians in the medical community.
That would be nice, but
yeah,
it helps that I'm a Lyme patient.
It helps a great deal. And I always tell patients, if you find a doctor who has had Lyme or a family member with Lyme, those make the best doctors, because you do get it. So that's really wonderful, because I know it's kind of a big topic for Lyme patients, but the use of CBD and THC where it's legal. But did you want to touch briefly on that? I know we talked at my son's baseball game once about it. Was like pretty enamored with your information that you offered, but I know it can be a long conversation. Did you want to touch on that at all for pain and diet? And
Sure, why not? So cannabinoids are really interesting substances. Both THC, which is the active ingredient in marijuana and synthetic marijuana too, and CBD, which does not cause the high. Both of those are very useful for things like nausea, loss of appetite, which I see quite a bit on some of my antibiotic treatments, and pain, and sleep, all those things.
anxiety.
And anxiety.
I want to throw that in. Sorry, I'm going to interrupt you.
And so, but interesting about it is they both bind to the same receptors in our brains, cannabinoids, but they act differently. The THC is an agonist, means it exerts an effect. In this
You cut out. Say that again.
THC is an agonist,
Okay.
which means it exerts an effect when it binds to the receptor. And so the high is one of the effects, whereas CBD is an antagonist, which means it actually blocks that effect. So both of them, however, have similar beneficial effects, as we talked about, for nausea, appetite, pain, and sleep. And so if you take them both together, then you can use less of the THC, have less of an issue with with high, which not everyone
One.
wants, and still get more of an effect. So I mean, more of an effect on the beneficial things we just talked about. So just as I actually had a young man who had chronic regional pain syndrome, and he was absolutely disabled by this. And he found that the only thing that relieved his pain was THC. Fortunately, he lives in Oklahoma now, where medical marijuana is legal. And but if he takes some THC, he doesn't have pain for 3 days.
Wow.
This is the only thing that ever relieved his pain. So, which, by the way, got better with on treatment.
Yeah.
But cannabinoids are very useful drugs. They're also used in treatment of addiction, opioid addiction, and saving lives.
Wow.
Because people can use THC, who are drug addicts, from opioids, and they can either get off opioids or use much, much lower doses. And so overdoses don't occur as well.
What about its use in seizures, muscle twitching, jerking? I know medical marijuana has been successful in Parkinson's, things like epilepsy. Have you anything to say about its use in?
Oh, I mean, I absolutely believe it can help with epilepsy and seizures, neurologic things, because there's been some data. So.
Yeah, very useful. Okay, I want to make sure to mention that nothing that you hear today from me is making medical advice. I always encourage people to speak with their physician and do their own research and homework. I am not a doctor and I don't make medical advice, but Dr. Feuer is, and he's excellent and he's available to take new patients. Dr. Feuer, how do people reach you?
So I have a website. It's txtiktok.com.
Love it.
Texas TikTok. And there's contact information there. My phone number is 346-336-6907.
Okay.
346. Everybody says the phone number twice, so I have to say it twice, right?
Please do.
346-336-6907. We actually, if you're interested in an appointment, we do better with emails sometimes. You can email my administrative assistant, Miranda. It's MARANDARENEF at Randall Feuer, that's FEUER, MD.com. And yes, she's my daughter.
Awesome. So we're going to put all that information down below in the captions when we publish this video. And one last thing is go Team Texas. I just want to encourage people to keep treating, never stop.
Okay.
And always look out for these excellent doctors like Dr. Feuer. And I just thank you so much for your time, talent, and treasure in treating Lyme patients. And it's such a difficult population to treat. And God bless you and your family for helping people like myself and my family along and getting to the bottom of some of these difficult things to treat.
Well, thank you. It's very kind of you to say.
Absolutely. You have a great Easter weekend.
All right. You too. Take care.
Yes, sir. You too. Thank you. Bye-bye.
Bye.